Hello everyone, good morning. Dear authors and invited guests, welcome to the technical session 10A. Myself Siddhi Yauti and I'll be your session moderator for today's conference. On behalf of Global Knowledge Research Foundation and GR Scholastics, it is my great pleasure to welcome you all to the 10th International Conference on ICT for Sustainable Development ICT4SD 2025. The 10th edition of the conference is being organized in a hybrid mode. Physical event is being held today in Goa, and the virtual event is being held via Zoom meeting from 17th and 19th July. I hope you all will enjoy this knowledgeable and interactive session throughout the day. In this session, in total, we will be having 10 presentations. Each presenter will be given a time span of 8 minutes for the presentation and 2 minutes for Q&A. I will be raising a gentle reminder after 7 minutes. This is a request to all the presenters to please consider the time constraint. Also, I request you all participants that you stay connected with us till the closing remarks. If you have any query or update, or if you face any issue, you can write it to me in the chat box. Now, just before we get started with the session, I would like to introduce you all to today's session chair, Dr. Ganesh Pise. Dr. Ganesh Pise is an assistant professor at Vishwakarma Institute of Information Technology. He has substantial experience in professional training and coaching industry, with expertise in technologies such as jQuery, HTML, JavaScript, web services, and software development. He is committed to fostering technical excellence and innovation in the field of computer science. I welcome you, sir, to today's session.
Thank you, Siddhi ma'am. Thank you, Siddhi ma'am.
Thank you, sir. Now I would like to start with the papers. Let's go ahead with the very first presenter, who is Neeta Dhakre from Datta Mega Institute of Higher Education and Research. And the paper title is Early Detection of Kidney Disease Using Ensemble Learning and Feature Engineering Techniques. Ma'am, please start with your presentation.
Yes, ma'am.
Hello.
Hello?
Ma'am, is there any issue with the PPT presentation?
No, ma'am. Ma'am, I'm unable to share.
Ma'am, you can just send your PPT to me in the chat box. I can share on your behalf.
Okay, ma'am.
Ma'am, just
I
give me a
shared.
second. I have received the PPT. I'll just. Ma'am, can you see the screen?
Yes, ma'am.
Ma'am, you can start with your presentation. Just tell me when you want to change the slides.
Okay. Hi, good morning, everyone. I am Neeta Dhakre presenting my research paper in ICT4SD 2025 conference. My paper ID is 11. Title of article is Early Detection of Kidney Disease Using Ensemble Learning and Features Engineering Techniques. I am from Faculty of Science and Technology, Datta Mege Institute of Higher Education and Research, Savangi Mege, Wardha. Author of this article is Ms. Neeta Dhakre and Dr. Shailesh Gahani, sir. Ma'am, please change the PPT. Content of this presentation is introduction, literature review, research gap, need of study, objective of research, conclusion, and references. Ma'am, please change the PPT. Ma'am, please change.
Ma'am, I've
this-
already. Okay.
Okay. This is the introduction of the topic. Chronic kidney disease, CKD, has emerged as a silent global epidemic. According to WHO, worldwide, around 850 million people are estimated to have kidney disease from the various causes. 10% of Indian population affected by CKD. CKD not only affected the quality of life, but also places an immense burden on healthcare system worldwide. CKD characterized by a gradual deterioration of kidney function over an extended period. Early diagnosis of CKD is crucial to improve the quality of life. Ma'am, please change. This is the literature review of the topic. First is title of article. First, chronic kidney disease prediction using machine learning. Focus of study, compare 4 ml algorithm for compare 4 ML algorithm for kidney disease prediction using a private dataset with 20 clinical features. A finding of the study, random forest achieve highest accuracy, 88%. Second is chronic kidney disease prediction based on machine learning algorithm. A focus of study compare 6 ML algorithm for kidney disease prediction using a public dataset with 28 clinical features. Finding of the study, XGBoost achieve highest accuracy, 94.75%. Title of the article, third is a comparative study prediction and development of chronic kidney disease using machine learning on patient clinical record. Focus of study, develop and evaluate ML models for kidney disease prediction using a private dataset with 24 clinical features. Finding of the study, decision tree and logical regression achieve uh, comparable accuracy 85%. Fourth is a title of the article, a comparative analysis of machine learning models, a case study in predicting chronic kidney disease. Focus of study, compare 5 ML algorithm for kidney disease prediction using a public dataset with 25 clinical features. Finding of study, gradient boosting achieve highest accuracy, 95.2%. Fifth title of the article, to predict the risk of chronic kidney disease CKD using generalized addictive 2 models. Focus of study, evaluate the performance of generalized additive 2 model compared to other machine learning algorithm for predicting incident kidney disease using electronic health record data. Finding of the study, accuracy is 88.9%. Ma'am, please change. This is the research gap I found. Despite promising advancement, research on kidney disease prediction using machine learning ML still faces several critical gaps. Variability in accuracy across studies and algorithm. Underutilization of ensemble and hybrid model for accuracy important. Third is limited attention to features selection and data quality for accuracy optimization. Ma'am, change. This is the need of study, relied the diagnosis in traditional method, importance of early detection, superior performance of ensemble learning, critical role of features engineering. Ma'am, change. These are the objective of research and research methodology. Aim, first is to understand suitable machine learning techniques for early kidney disease prediction. Research question, what machine learning techniques are best suited for early kidney disease prediction? What existing models have been used for early kidney disease prediction? Research objectives, to study different machine learning techniques and existing early predictive models for kidney disease. Research methodology use, literature review of existing research on machine learning and early kidney disease prediction, analysis of existing early kidney disease prediction models. Second is to assess the effectiveness of existing model. Research question, how well do existing model perform in early predicting kidney disease? What are the strength and the weakness of the model? Research question is to analyze model performance of different existing early predictive model for kidney disease. Research methodology use, collection and analysis of dataset for early kidney disease prediction, evaluation of existing model using metrics like accuracy, precision, recall, F1 score, and AUC and ROC curve. Third is to develop a novel model for early kidney disease prediction, improve accuracy. A research question is, can a novel model outperform existing model in kidney disease prediction?
Ma'am, sorry for the interruption, but we are past the presentation time. Can you please get to the conclusion?
Okay, ma'am.
Ma'am, is there any result you achieved in this case?
What, sir?
Result? Is
No,
there
sir.
any result in your research? Okay. What is mean by ensemble learning? Can you elaborate in detail?
Combination of different machine learning techniques.
Which techniques you have used for your research? Which combinations you have considered for this research?
XGBoost.
Only one?
Yes,
Then
sir.
how are you to call this is the, if you are using only one technique, XGBoost, then how we can say this is the ensemble learning? We should use
Sir, XGBoost and logical regression.
LR and XGBoost. Okay. What will be the accuracy of the LR and what will be the accuracy of the XGBoost in your case?
85 to 94%.
85 to 94%. How you have selected the LR and XGBoost for the ensemble learning?
This is easy to implement, sir.
Okay, easy to implement. Okay. Have you, are you going to use the data set?
Yes, sir.
Answer is yes. Okay.
Yes,
So
sir.
which parameters you are going to consider in this case? Demographic and main clinical things you are using
BP,
here.
sugar, uh, BP, sugar,
Okay.
and different.
Have you done the data validation? Whatever the data set you have considered?
What, sir?
Data validations.
I use Carol
Okay.
data set.
How you are going to clean the data?
Data
What are the steps?
pre-processing.
Data pre-processing. Okay. What is the size of your data set which you are going to use during your research?
500.
500 what? Rows or columns or size, something else?
Rows.
Rows.
Yes, sir.
Do you think this is the very large data set or small data set? What is your opinion?
Moderate, sir.
Moderate. Okay. Done from my side.
Thank you, ma'am, for your presentation.
Okay, thank you, ma'am.
Now we will go on to the next presenter. The next presenter is Ritika Tiwari from Datta Mega Institute of Higher Education and Research. And the paper title is Issues and Challenges of MRI-based Brain Tumor Detection Using Deep Learning. Ma'am, you can start with your presentation now.
Yes, ma'am. Ma'am, is my slide is visible?
Yes, ma'am.
Okay, thank you, ma'am. Good morning to all my dignitaries. I am Ms. Ritika Tiwari presenting the paper on issues and challenges of MRI-based brain tumor detection using deep learning, Faculty of Science and Technology, under the guidance of my guide, Dr. Shailesh Gahane. The flow of my presentation will be the introduction, followed by the literature review, research gap, need of the study, objective of the research, with the proposed steps and flow charts, with conclusion and references. Here, Introduction. The early and accurate detection of brain tumors is crucial for successful treatment and better outcomes. So we are using deep learning techniques, especially convolution neural networks, which have a sign to improve the tumor detection from MRI scans and MRI images. Brain tumors are very complex and vary greatly over 200 types and require a specialized imaging for classification. Manual diagnosis is very challenging, hence automated image segmentation is critical for identifying the regions precisely. Medical image processing using 3D MRI datasets supports the diagnosis, surgical planning, and other anatomical modeling. This study actually proposes a deep learning and reinforcement learning framework to enhance the brain detection accuracy and make the decision wisely on that. MRI plays a key tool for non-invasive diagnosis of brain tumors, which offers a high resolution imaging power. The introduction here, I have seen the chart of brain tumor detection in the form of second CRS and HIPEC, which actually scans CT computed tomography, MRI magnetic resonance images, CEA carcinoembryonic antigen, cancer and antigen 19 and 19. So here basically imaging on CT and MRI is of 46 percentage. Imaging on tumor markers, which is represented into 45%. Only tumor markers are represented into 5% and obstructions parts are represented into 4%. This is my some of the literature review paper which I have been reviewed and have a remark on that. First is brain tumor segmentation using convolution neural networks. Here I have been seeing how CNN have been implemented and features of MRI images are extracted from it. Similarly, the coefficient of the values are 0.85 using the CNN based model, which indicate a high segmentation accuracy. Next, which shows the part of brain tumor detection using deep learning techniques here with the use of fine-tuning pre-trained models. Research classification have the accuracy of 93.5% and 92.1%, which show the result of transfer learning, improve model performance while reducing training time and data requirement, making it a powerful approach in medical image task. Deep learning for brain tumor detection, a review which have a part of importance of a data augmentation and normalization for improving the performance of a deep learning models by flipping or rotating these images which is presented over there, which help to increase the data set diversity. uh, mTOR roles of an mTOR signaling in brain development. Here, the mTOR signaling is used for cell growth, particularly regulating a cell growth and the proliferation and survival rate of it. The study emphasizes the disruption in mTOR pathways could have significant implication for neurological disorders. Next review is on the basically with the help of CNN in MRI images, which achieve impressive accuracy, which with the strong overlap metrics validating the potential of CNN in delivering precise and automated tumor segmentation for clinical applications. A survey on brain tumor detection for a medical imaging sensors. Here the role presented on the sensors, which reviewed a key architectures like CNNs, RNNs, and GANs, which outlines their respective advantages and limitation, provides the valuable insights into selecting suitable models based on the task requirements, and highlights ongoing challenges in the field. Next, what research gap I have been identified from all this paper is firstly the limited generalizability across data sets, dependence on large label data sets, which in terms of insufficient interpretability of models, unexplored hybrid architectures are presented, lack of clinical validation and real-time implementation. What will be the need of the study for this particular paper will be firstly confined data sets, variability in imaging protocols, confined generalizability with the help of the computational assist, interpretability and explainability with the help of medical validation, which provides facts of privateness and safety. The objective of this study is firstly to broaden and advance deep learning model for correct and green detection and segmentation of the tumors for MRI images, to analyze the effect of various deep learning architectures along with CNN, U-Interact, performance of tumor detection and type in MRI scans, to assess the generalizations capability of deep learning algorithm to know the information which is educated on the basis of the MRI data sets and evaluate the robustness throughout the exceptional population and imaging conditions, and to lay out and put in force to optimize pre-processing pipeline for MRI images that improves the quality of the input facts and enhances the performance of a deep learning models. Research methodology, first we need to acquire the data sets which will be in the form of BRATs or TCI or an actual data set with the help of a medical sector. Next is processing of that data set in the form of including noise reduction, intensity normalization, scalp stripping, and modulation in the part of rotation and contrast changes. Annotation, the tumor regions are manually labeled by radiologists to create segmentation. Mask for supervised model training, designing of the model with the help of providing the algorithm in the base of CNNs or unit or transformer based architectures. The training strategies should include data to split into training into 70%, validating for 15%, and testing for 15%. Combining the reinforcement learning, which will act as a reward for the deep learning, we can use the algorithm of Markov decision process, which is also implemented using the algorithm of PPO and A2C to provide improve the segmentation through the rewards. Performance evolution, which provided metrics such as accuracy, precision, recall, F1 score, ASC, Jacquard index, along with the K-fold cross validation for robustness. What will be the purpose steps and flowchart? First, we will be using the algorithm and combining the algorithm with the deep learning with the reinforcement learning. Next, we will be using the data sets which is collected from the BRATS TCI or in any medical sector. Then processing the steps by reducing the noise, skull stripping, normalization, then providing the algorithm which we have been selected from the reinforcement part, then integrating it using MDP with agents, learning segmentation via reward facilities. Reinforcement algorithms like DQN, PPO, and A2C help refine tumor localization through iterative learning. Model performance is evaluated using accuracy, DSC, IOU, and other metrics with cross validations. These are a flowchart which is representing a image which we have been collected from the medical sector, then processing it by resizing and rotation and doing the conversion into then extracting the feature by providing the model-based feature intensity and classifying into the convolution networks, which means that we are providing the algorithm which we will be using, which will be shown as the performance, and then we will training and testing the particular image into the classifying into healthy tumor or healthy brain or a tumor brain. So this is the conclusion. Basically, this study effectively demonstrates the deep learning in the modern fashion, which is more important, and the reinforcement techniques outperform traditional CNN-based techniques in MRI-based brain tumor segmentation. Incorporating reinforcement modern-day techniques, the version learns premier segmentation dynamically, leading to an advanced accuracy, generalizations, and robustness. The outcome suggests that the proposed version achieves state-of-art overall performance, making it a tool for automated medical imaging evaluation. Future research has to cognize and on optimizing computational efficiency, increasing the dataset ranges and the version effectiveness in actual world hospital settings. The study actually highlights the potential of mixing deep learning and reinforcement learning to strengthen the analysis and paving the manner for extra accurate and dependable AI push brain tumor prognosis practice. Here are some of the references which I have been shown in the literature review, which I have been referred, and total papers I have been referred is 23. Thank you so much.
Okay. Thank you. Very nice presentation.
Thank you, sir.
So I have a few questions.
Yes.
How you are going to measure the accuracy?
So with the algorithm here, I have decided to put an algorithm. Firstly, I have been decided to put an algorithm of CNN, that is convolutional neural
Okay.
network.
You said the
Then I have been
precision, you
sorry.
said the precision, recall, and all parameters you are going to consider here to show
Yes, sir.
that what is
Yes.
what is meant by precision, and can you tell me the formula, how formula is used?
For which, sir?
Precision.
Precision.
Hmm? What is meant by
Precision.
precision, and what is the formula of precision?
Precision formula is true positive. True positive divide by true positive plus false positive.
Okay. What potential impact does these advanced techniques? Yes.
Potential impacts, sir, it will
Yeah.
help for a better accuracy part, because when I was referring the paper for CNN, it was giving the accuracy, highest accuracy was 87 to 90%. But when I saw the technique of reinforcement learning, so it was providing till 91 to 96% accuracy. So I decided to work on
Okay.
reinforcement.
What are the challenges are associated with this processing the MRI images?
So firstly, data collection, because we will be not able to get the tumor data set. Second, that is a clinical validation we will be not able to get, and augmentation will be little difficult.
Okay. How many research paper you have reviewed?
So 23 research paper I have been reviewed, and I have taken views from 6 to 7 papers.
Okay. Is this your research is belongs to the Master of Engineering or Bachelor of
So this is
Engineering
for
or
my
PhD?
doctorate, sir.
So what do you think is these papers are sufficient?
So this was my first paper. I'm just trying to
So,
review all the
I have
papers.
one suggestion.
Yes, sir.
What is the accuracy you are presenting?
Yes, sir.
That is not the highest accuracy.
Oh, yes, sir.
If
Okay,
you go
sir.
with the recent papers,
Okay, sir.
you see, so much accuracy they have achieved. More than 98% accuracy they have achieved.
Okay.
So during your research,
Yes.
so find out that papers
Yes.
and see what techniques they have used to get
Yes.
the more accuracy, because this is directly related to the human. So
Yes.
there should not be a error in this system.
Yes, sir.
So find out the research, recent papers, and use in your module.
Yes, sure, sir. Sure, sir.
All the best.
Thank you,
That's
sir.
it
Sir,
for
can
now.
I be in a contact with you for any guidance?
Yes, yes, sure, sure, sure. You
Okay,
can
okay.
go with the VIT website, IT department.
Okay.
You will get my details.
Okay. Okay. Thank you so much, sir, for your guidance. Thank you.
Yes, yes. All the best.
Thank you, sir.
Thank you, ma'am, for your presentation. Now we will proceed further. Now there seems to be a lot of participants absent, but I'll just announce everyone's name once. Then, if no one is there or no one has joined any of the co-authors, then we can end the session. So first is Vedant Vaidya from Datta Mega Institute.
Ma'am, I
Second is,
think there is any issue. Many
yes,
participants are due to some unavoidable problem. They are unable to join right now. So I got that message from the organizing team.
okay.
So just you can display it as a part of formalities.
Yes, I'll just complete the formality once.
Yes, yes.
Once we'll just announce their names.
Yeah.
Second is Shailesh Gahane. Again, Vanshika Landge. Ritika has already done the presentation. Prachi Mandade. Uh, Lal Mohan Kumar. And that's it. Like, same authors are there. We can just proceed further, I guess.
Yes, yes.
So I sincerely thank you, sir, for your both the um, participants for your excellent presentations and contribution in this session, and for being a part of this international conference. I hope this session was informative. We on the whole team of ICT4SD, thank you for your support during 10th
Thank you.
version and
Thank
all
you,
the
Siddhu
previous
ma'am.
9 versions.
Yes, yes. Thank you. Thank you so much for inviting me as a session chair. your team, your all the members are very kind, and whatever the research we are reviewing, we are getting so many things out of it. So 10 topic was there. I gone with all the abstracts, very nice papers you received for this conference. I also learned so many things. Authors are doing very well, and this is your achievement. Actually, ICT is doing very well. They are connecting all the researchers. That is very positive sign for this conference. So
Yes.
I thank you to ICT team, Amit sir, Siddhi ma'am. Thank you once again.
Thank you so much, sir, for your very kind words. This
Yeah.
is a token of appreciation from our team for you. Uh, Lastly, I just have one announcement. I just want to inform the participants that you will get your digital certificates within 2 working days. And all the papers have already been forwarded to the Springer, so the publication will be live within 7 to 8 months. So kindly just cooperate with our team, and you'll be getting the certificates soon. And thank you so much, everybody, for joining this session. Now, before ending, I would just request you all to please turn on your camera so that I can take a snapshot. We'll just wait for one person. Okay, I've taken the snapshot. Now we can end this session. Thank you, sir. Thank you, everyone.
Thank you, ma'am. Thank you.
Thank you, sir, once again.